are there any drawbacks to long-term use of LDN? So this is kind of where I actually am optimistic that the longer somebody uses LDN, the more likely we'll get the benefits. And this is why that survey that we're promoting is very important, because I really do want data on people who've been using LDN long-term. My strong suspicion, and of course we need data to back this up, my strong suspicion, the longer somebody uses LDN, the healthier they'll be in a variety of different ways. And that's why I'm really trying to push for LDN for longevity to help prevent diseases of aging. In terms of liver stress, like I mentioned in my presentation, there's no reason to believe that LDN has any, puts any stress on the liver. And in fact, if anything, I've seen an improved liver function in patients. If you look at kind of the FDA warnings for naltrexone, there is some information on there about liver toxicity. That's all because the really early studies on naltrexone had to do with alcoholic patients. So it's thought that they had really bad livers to begin with, and then you're throwing naltrexone, and so it's really hard to tease out from these early trials. So I think the FDA, out of precaution, put that liver warning on there. But I mentioned the case of a 26-year-old female who took an entire bottle. I'm not suggesting anybody do that, but they took 1,500 milligrams of LDN, or no, that wasn't LDN, sorry, it was regular naltrexone. So she was prescribed a 30-day supply of naltrexone, the 50 milligram tablets, and she took the whole thing. I guess apparently she thought she would try to end it all, but actually ended up turning her clean. It lasted so long in her system that it gave her enough time to clean. It was a very interesting case report in the literature. So that kind of highlights that there's no acute toxicity to it. I mean, 1,500 milligrams is a massive dose. So there's no reason to believe that there'd be any chronic toxicity to it either. And like I said, if anything, things like, fatty liver disease and, kidney dysfunction, a lot of those are driven by sterile immunity or autoimmunity or inflammation. And a lot of those, like we've talked about, are improved with LDN.